Hello, my name is Valerie Chu.
Hi, my name is Noor Akhter.
Hello, my name is Tan Hua.
Hello, my name is Zoua Vang, and I am a fifth year double majoring in human development and psychology.
Hmong Lifting Underserved Barrier Clinic would like to thank UC Davis School of Medicine, Dr. Christian H. Bohringer, and Dr. Ronald Jan for their support in helping HLUB Clinic attempt to improve the health of the Asian Pacific Islander community. A special thank you to George Yang for guiding our team throughout the process.
Mental health is the overall well-being of an individual, including emotional, psychological, and social well-being. Our mental health impacts how we feel, our thought processes, and our behaviors. According to the National Institute of Mental Health and Research, mental health issues have rapidly increased in people between the ages of 18 to 26 in the United States. Mental health is sensitive to traumatic events and their social and economic consequences. The event of the COVID-19 pandemic has impacted the mental health of the entire nation. In particular, there has been recent studies that show that the COVID-19 pandemic has exacerbated mental health issues in the Asian Pacific Islander American, or APIA, population. At the beginning of the pandemic, acts of xenophobia were increasingly placed on the APIA community, raising concerns about their livelihood and well-being amidst a global event that placed hate on the APIA community. The stress from the pandemic contributes even more stress to the minority groups within the APIA community, as they already experience higher levels of stress as a minority group, as described by the minority stress theory. From these accounts alone, we clearly see that COVID-19 has strongly impacted the APIA community. The purpose of this study is to investigate the degree of impact of COVID-19 on mental health and to provide statistical evidence addressing the overall mental health and well-being of Asian and Pacific Islander Americans ages 18 to 30 in Yolo County and Sacramento County.
All right, welcome to our methodology and materials section of our presentation. Once again, my name is Tan, and for our methodology, our total sample size consisted of 147 participants aged 18 to 30 and consisted of 32 participants identifying as Caucasian and 94 participants identifying as Asian Pacific Islander. 87 participants were students, while the remainder consisted of either non-student or left the answer blank or not applicable. An online survey was conducted in which participants were asked to rate statements on a Likert scale from 1 to 5 based on their mental health, healthcare access, and academic performances during the pandemic. The survey was created utilizing Qualtrics XM software. Statistical values from the data extracted from the survey results were analyzed with the software package Statistical Package for the Social Sciences, also known as M.B.B.S. Questions within the survey included rating statements related to factors contributing to mental well-being, such as a participant's experience with anxiety, depression, mood averages, stress, healthcare access, once more, and academic performance during the COVID pandemic period. The survey was made available to the public from January 20th, 2021 to February 3rd, 2021, and was distributed to UC Davis affiliated organizations and Yolo and Sacramento County communities. A literature review was conducted prior to the creation and distribution of the survey and consisted of scientific papers from peer-reviewed journals relating to the mental health of Caucasians and Asian Pacific Islander communities, as well as the impacts of COVID-19 on these two populations as a whole. Lastly, survey questions were influenced by the literature review findings based on these reviewed journals.
For question 20 of our survey, we asked participants to rate 7 statements on how COVID-19 has impacted their mental health and well-being. 1. Being sleeping behaviors. 2. Eating behaviors. 3. Social isolation. 4. Depression. 5. Anxiety. 6. Stress. 7. Mood. For the first statement regarding sleeping behaviors, we decided to not include this statement since the results were inconclusive. For our second statement, we asked participants how COVID-19 has impacted their eating behaviors. As shown in Figure 3-1, our p-value was 0.002, which demonstrates that there was a significant difference between the APIA community members and Caucasians. Using Figure 3-2, we observed that the mean rank of Caucasians was 60.07, which was larger than the mean rank of the APIA participants, which was 41.89. This shows that COVID-19 has negatively impacted Asians' eating behaviors more in comparison to Caucasians. Our third statement asked participants how COVID-19 has impacted their social isolation. As shown in Figure 3-1, the p-value was 0.001. Since this p-value was less than 0.05, the results demonstrate that there was a significant difference between APIA community members and Caucasians. Using Figure 3-2, we observed the mean rank of Caucasians to be 60.07, which was larger than the mean rank of the APIA participants, which was 40.25. This shows that COVID-19 has negatively impacted Asian social isolation more in comparison to Caucasians. For our fourth statement, we asked participants how COVID-19 has impacted their depression. As shown in Figure 3-3, the p-value was 0.005. Since this p-value was less than 0.05, this results demonstrates that there was a significant difference between APIA community members and Caucasians. Using Figure 3-4, we observed that the mean rank of Caucasians, which was 59.66, was larger than the mean rank of the APIA participants, which was 42.88. This shows that COVID-19 has negatively impacted Asians' depression more in comparison to Caucasians. For our fourth statement, we asked participants how COVID-19 has impacted their depression. As shown in Figure 3-3, the p-value was 0.005. Since this p-value was less than 0.05, this results demonstrates that there was a significant difference between APIA community members and Caucasians. Using Figure 3-4, we observed that the mean rank of Caucasians, which was 59.66, was larger than the mean rank of the APIA participants, which was 42.88. This shows that COVID-19 has negatively impacted Asians' depression more in comparison to Caucasians. For our fifth statement, we asked participants how COVID-19 has impacted their anxiety. As shown in Figure 3-3, the p-value was reported to be 0.010. Since this p-value is less than 0.05, the results demonstrates that there was a significant difference between APIA community members and Caucasians. Using Figure 3-4, we observed that the mean rank of Caucasians, which was 58.69, is larger than the mean rank of the APIA participants, which was 43.30. This shows that COVID-19 has negatively impacted Asians' anxiety more in comparison to Caucasians. For our sixth statement, we asked participants how COVID-19 has impacted their mood. As shown in Figure 3-3, the p-value was reported to be less than 0.000. Since this p-value was less than 0.05, this results demonstrates that there was also a significant difference between APIA community members and Caucasians. Using Figure 3-4, we observed that the mean rank of Caucasians, which was 64.07, was larger than the mean rank of the APIA participants, which is 40.94. This shows that COVID-19 has negatively impacted Asians' moods more in comparison to Caucasians. For our seventh statement, we asked participants how COVID-19 has impacted their stress. As shown in Figure 3-3, the p-value was 0.007. Since this p-value was less than 0.05, this results demonstrates that there was a significant difference between the APIA community members and Caucasians. Using Figure 3-4, we observed that the mean rank of Caucasians, which was 59.16, was larger than the mean rank of the APIA participants, which was 43.10. This shows that COVID-19 has negatively impacted Asian stress more in comparison to Caucasians. For the results portion of our study, we have decided to exclude certain data from our analysis since there were excess information that did not pertain to our area of study. Sample sizes will be different in some questions since some were unanswered. Calculations were done on SPSS using the Mann-Whitney test. We prepared an observational study where race/ethnicity was our nominal variable. Our observational units were Caucasians and Asian Americans, both having a corresponding sample size of n equals 29 and n equals 65. Random sampling was used to gather subjects ages 18 through 35 within the Sacramento community. Our survey has a different amount of statements that request participants to rate on a Likert scale how strongly participants agreed or disagreed with the statement. A rating of 1 correlated to strongly disagreeing, while a rating of 5 correlated to strongly agreeing with the statement. For one of our examples, for question 16, how was COVID-19 impacted your mental health and well-being, the p-value for this question was less than 0.05, which means that there is a significant difference between Caucasians and Asian Americans in regards to how COVID-19 has impacted the mental health and well-being between these two groups. The mean rank of the overall health and well-being of Asian American population was also smaller than the Caucasian population, which means that COVID-19 has negatively impacted Asians' mental health and well-being more than Caucasians.
In the discussion section of our research, we see that in previous studies that COVID-19 has increased the prevalence of depressive symptoms in U.S. adults. Based off of these findings, we chose to investigate the impact on mental health in the APIA population in the greater Sacramento area. Our data shows that COVID-19 has impacted the mental well-being of our APIA participants more than our Caucasian participants. Our APIA population has reported that COVID-19 has exacerbated their feelings of stress, negative mood, anxiety, and depression. Additionally, we delved into whether the APIA population felt that if they had an increased risk to exposure for COVID-19 or not. We came to the observation as previous literature has shown that Asian population is more likely to be hospitalized with COVID-19. We came to the thought that the increased risk of exposure could be due to low socioeconomic status, being an essential worker, and limited healthcare access. However, we found that the APIA population felt that they were not at a higher risk of contracting COVID-19 compared to Caucasian participants, and healthcare inaccessibility was not a concern for them. Additionally, we chose to focus on college students, as currently in this pandemic, many academic institutions are concerned if students would be able to manage remote learning, since students face the unique obstacles such as access to the internet, familial obligations, and maintaining good academic performance. We found a significant difference between our APIA Caucasian students, as our APIA students have reported that meeting familial obligations, having less access to the internet, and impaired academic performance is more felt for them than their Caucasian counterparts. However, on the other hand, there was no difference when it came to whether students' mental health was impacted by remote learning for both groups. Overall, we found that the APIA youth reported that COVID-19 has negatively impacted them more than their Caucasian participants.
Hello, my name is Valerie Chu. From our data, we observe that Asian and Pacific Islander American youth self-reported more than Caucasian youth that COVID-19 had negatively impacted aspects of their mental well-being, such as depression, anxiety, mood, and stress levels. Our study does, however, pose several limitations. Our first limitation involves our sample sizes of the APIA and Caucasian participants. The number of respondents of our two study populations were not equal. Due to this limitation, we cannot conclude that our research possesses external validity, nor can we conclude that our study can be generalized to populations or regions outside of our study. Our second limitation within our study involves the limited available studies looking at the APIA and Caucasian communities during and prior to COVID-19. The papers within our academic literature review addressing COVID-19 effects on our two sample groups were limited in number due to the novelty of the virus in our early stages of research. Improvements to our study include ensuring equal sample sizes between the APIA and Caucasian populations, and expanding survey accessibility beyond Internet users. Additional data that we have collected warrant future research investigating the academic, social, and socioeconomic consequences of COVID-19 on the APIA youth, as well as exploring how COVID-19 has influenced the mental well-being of the API and Caucasian populations in geographic regions beyond the Sacramento and Yolo County. Using our findings, we hope that mental health initiatives take measures to advocate and distribute more culturally sensitive and API-specific mental health resources, education, and services to empower the API youth during this global crisis.